In April 2006, an incident occurred at a hospital when a patient being treated with an ointment for a skin condition died after accidentally setting fire to himself. The 60-year-old man had suffered with psoriasis on much of his body for many years and regularly sought hospital treatment when his symptoms worsened. His wife noted that the ointment he was treated with used to soak through his clothes when it was applied. After a daily treatment at the hospital with a paraffin-based ointment, the patient dressed and stepped out onto a fire escape for a cigarette.
Tragically, the ointment-soaked clothes ignited and the patient was engulfed in flames. A student nurse and sister tried to put out the blaze with a fire extinguisher, but the patient suffered 95% burns to his body and later died. At the subsequent inquest, the coroner said liquid paraffin, which is widely used worldwide to treat psoriasis, could clearly be flammable and needed treating with caution. He said he was satisfied that the patient went onto the stairwell for a smoke with a lighter. The liquid treatment had probably permeated his dressing gown, and when he lit up, he started a fire of some ferocity, accelerated by the liquid on his clothing. The inquest recorded a verdict of accidental death. Unfortunately, this isn't the first time this type of incident has occurred. A similar incident was recorded in 2001 involving paraffin-based products, in which a patient received extensive burns.
Many different skin products contain paraffin. Some have significant paraffin content, like emulsifying ointment, white or yellow soft paraffin, and liquid paraffin. Some of these products are widely prescribed, dispensed and administered. Often patients use them at home where they may live alone. Following the incident, the National Patient Safety Agency commissioned the Health and Safety Laboratories to undertake fire testing using paraffin-based emollients to see if ignition could be recreated under test conditions and to determine the potential risks of paraffin products with different materials.
On the left is a dressing that has not come into contact with white soft paraffin, and on the right is a dressing that has been impregnated with the product. As expected, the dressing soaked in white soft paraffin burns much more vigorously. This could happen if a dressing is placed over skin that's been covered in a thick layer of skin product with a significant paraffin base. One common method of applying paraffin-based products to babies is to smear them inside the baby grow, which is then put on the infant. On the left is a baby grow which has not come into contact with white soft paraffin. On the right is one that has been impregnated with it. The difference in flammability is clear. Here the left-hand side of the gown hasn't come into contact with white soft paraffin, and the right-hand side of the gown has been impregnated with it. When trying to put out the blaze, it's clearly much more difficult to extinguish the half of the fabric that has been impregnated with white soft paraffin.
The Health and Safety Laboratory concluded that paraffin contamination leads to a more rapidly growing fire, which burns much more intensely and is harder to extinguish. Further tests on a dressing gown showed even a small area of contamination may markedly increase the risk associated with ignition.
The National Patient Safety Agency has made the following recommendations. Patients should be given information that includes advice about the potential fire risks of smoking or being near to people who are smoking, or exposure to any open flame or other potential cause of ignition during treatment. In hospital units initiating therapy, this advice should be given in both verbal and written form. Patients and their families should be provided with safety advice about regularly changing clothing or bedding impregnated with paraffin-based products, preferably on a daily basis, as the paraffin soaks into the fabrics and can potentially be a fire hazard. Chairs or seating may also have the potential to become contaminated. This information should be given on the first occasion that such treatment is prescribed, dispensed or administered by a healthcare professional, and a record kept confirming that such advice has been given. A check should be made on subsequent occasions that the advice has been received previously and understood. Patients should be encouraged to give the information about their treatment and any advice they've received to their relatives. The smoking status of patients should be established before commencing treatment. Patients who do smoke should be offered practical help and advice and continued support to stop smoking. Fire safety information should be displayed prominently in every ward area where patients may be treated with significant quantities of paraffin-based products. If, against advice, a patient intends to go off the ward to smoke, they should be informed of the risk and advised to wear a thick outer covering that hasn't been contaminated with paraffin-based products. Relatives or carers should be informed if a patient doesn't comply with safety advice and instructions during treatment involving significant quantities of paraffin-based products. Although the testing was carried out using white soft paraffin, the guidance should apply to any product that contains more than 50% paraffin. A list of the most commonly used products is available on the NPSA website. Although there may be other products which contain more than 50% paraffin and are used in relatively large quantities of more than 100 grams. This applies particularly to non-standard products or specials made up for individual patients. To help organisations implement these recommendations, the NPSA has produced sample posters and patient information leaflets which can be downloaded from their website and produced locally. Some trusts have developed their own materials, which has the advantage of allowing local information, such as contact details, to be added.
In addition, the NPSA is now in discussion with the Medicines and Healthcare Products Regulatory Agency to try to ensure appropriate warnings appear on manufacturers' packs. In the meantime, if you're using paraffin-based products to treat your patients, remember they are very flammable and they can be fatal.